Thank you for tuning in to watch our Invest Houston launch conference. You're about to watch panel number 1, Revolutionizing Healthcare. Enjoy. While I talk to my esteemed panelists. Panel, thank you very much for being here today. I'm really looking forward to having this conversation on healthcare, which I think is universal in every way that you can imagine. Every single one of us is affected by healthcare individually, as companies, and so I can't think of a more worthy discussion to start off our Invest Houston with. To give a little bit of a background, healthcare sector in the Houston region has grown to become a significant economic driver in recent years. Despite this, challenges that range from organizational inefficiencies to disparities in care and outcomes remain prevalent. The region's leaders are actively tackling these issues, and technology and innovation are among the key new tools at their disposal. In this panel, our panelists will discuss the perspectives on how to use new and emerging technologies, including artificial intelligence, to help better position Houston for a successful, healthy future. And so to kick off this very weighty discussion, I'd like to throw a question out to all of my panelists. To begin, in your view, on what are the ways artificial intelligence and machine learning have been leveraged to enhance diagnostic accuracy and streamline processes in healthcare and insurance settings? And what initiatives have your company specifically put in place? I've introduced you all as you've come up, but if you could please remind the audience of who you are as you answer that first very meaty question. Bill, would you like to start off as you happen to be sitting next to me?
Sure. Good morning, everyone. Bill McKeon, Texas Medical Center. I'm the president and CEO of this massive medical city that you all know so well if you're all local. One of the things that's interesting about machine learning we've been using actually for a very long time when we look at applications, or you might hear the clinical trials on our campus. We're the largest platform in the United States. So when you think about a clinical trial, for years, what people used to do is have to go through your patient files manually. Nurses or clinical nurses would have to actually look through, and it's not just hey, this person has had breast cancer stage 1. They've got to go through and look at all of your treatment that has happened. And so that's a very laborious task for a researcher. So machine learning and now AI will actually scan all of the data sets. We did something, it was interesting at MD Anderson. So they found a number of patients over a 2-year period. We ran our AI platform against it, and so that took 2 years to find those patients. We ran it, and within 3 minutes, we found every one of those patients and another 25% patients that qualified. And that's the power of an AI platform that can actually look through both structured data, which is kind of your electronic medical record, and then unstructured data, which are the physician's notes. So it's really transformed the platform of clinical research for us. That's just one example.
Excellent.
Yeah, sure. I'll go next. University of Texas Medical Branch, Jamie Bailey, CFO. I've been there only for about 5 months. Prior to that, I was at Baylor College of Medicine in the medical center for roughly 12 years. So we've done a lot of things on the UTMB front in terms of AI and trying to leverage different technologies. We've actually established an AI council. We have a chief integration and AI officer who now engages all of our stakeholders to evaluate different opportunities, whether it's on the clinical front, research side, or in the education area. Some of the things that we've done clinically, though, to Bill's point, is really try to create efficiencies for our physicians. So we've looked at ambient documentation, AI technologies, whereby, you know, when a doctor is seeing a patient, they can focus on the conversation with the patient as opposed to documenting in the electronic medical record. So we've instituted those types of things to create those efficiencies. It's actually a more robust documentation and note-taking platform for us, multi-languages there. So there's a lot of opportunities where the physician can really focus on the patient, focus on what the issues are, and hopefully come out with better outcomes as well. So we've got a lot of focus, a lot of different initiatives we're evaluating. Obviously, the technology is rapidly changing. The environment is quick and fast. So we want to be nimble enough to be able to handle and evaluate some of those opportunities, which our AI Council can hopefully help us do. So a lot of things at the forefront, at least at UTMB, in terms of AI.
Excellent. Kengo?
Hi, my name is Kengo Takishima. I'm a CEO of Baylor Genetics. Baylor Genetics is a genetics testing company. We provide the genetics diagnostics to a rare disease patient and the cancer patient. And also we provide the prenatal testing. So we became independent from Baylor College of Medicine about 10 years ago. Then we became one of the largest genetics testing lab in the United States. And we process around 300,000 samples every year. So in genetics testing, so in our operation, we utilize AI, quite frequently. So that the overall process is like, so we try to get the genetics information of the patient through processing DNA samples. Then once we get the genetics information, the next step is just data analysis. So in order to do the right data analysis, basically we try to identify variants of genetics from the patient in order to find the right variants, prioritize the variants which makes an impact to the patient condition. So we have to utilize a lot of data, including our historical database and also public database, and even like latest research and knowledge, new knowledge. So by incorporating those knowledge, we can come up with right or diagnostics. Of course, this cannot be done by AI. So but by utilizing AI, we can accelerate the speed of diagnostics, and we can access the latest information. So then after that, our clinical genetic expert will do diagnostics by utilizing the data, which is created by the power of AI. So that is one of the example which we utilize AI very actively.
And Rodgers?
Hi, I'm Rodgers Wilson, the National Medical Director for Behavioral Health at Cigna Healthcare. By training, I'm an adult and forensics psychiatrist. This is a great topic, and I was listening this morning about the Secretary of Energy actually meeting with OpenAI to discuss the energy needs associated with artificial intelligence. From a healthcare perspective, AI has been very useful to help us look at social determinants of health, identifying needs in our patients. Imagine also being able to put care management services in place before a patient develops a specific diagnosis. So it's really helped with care pathways in oncology, musculoskeletal disorders, cardiovascular disorders. From a behavioral health perspective, we have been focused on identifying high-risk eating disorders. So a patient who has an eating disorder, is that eating disorder going to a point of hospitalization due to electrolytic imbalances? Also identifying children progressing toward an autism diagnosis. We're able to look at individuals and understand whether a particular individual on pain medication is actually at risk for opioid overdose. We're able to use AI models to identify cardiovascular patients who may be at risk for a behavioral health condition. So the use of AI going forward is going to have an incredible impact on healthcare. But I think we also have to level set. We really need to put ethical structures around artificial intelligence. And I know our chief health officer at Cigna is doing a lot of work in this area. We have to remember, if there's bad data going into a system, we're going to get a bad outcome from data. And again, I think we have to be humble about the risks of AI in addition to the advantages of AI. I was recently told by, I actually have a nephew who got his master's in AI. And we were discussing bias as it relates to race. There have been some AI models created that, for example, exclude young Black women. So again, these systems have difficulty getting to conclusions related to certain ethnic groups. So as we use AI in healthcare, we need to be very conscious of the risks of AI.
As you're speaking, I know that AI it provides so many benefits, and speed is one of the most important ones. The faster we can come to a diagnosis, the faster we can do treatment, the faster we can predict things, the better health outcomes. But you make a really good point about the ethical question. And so if anyone else would like to chime in, Rodgers, you just kind of mentioned how you're keeping ethics top of mind when considering AI. Are there any other measures that anyone else on the panel is taking to ensure that when AI is implemented, we are keeping ethics top of mind?
I think one of the things that people don't realize, it's another power play by Houston, is we celebrate our diversity here, being the most diverse city in the country. And when people from New York or LA kind of come here and say, how is that possible? And it's really these great assets of energy corridor, the medical center, the port, space programs now really brought a diverse population of people to Houston, which was a cow town not too long ago. But one of the things that is a powerhouse is because we're the most diverse. You remember, obviously, the COVID vaccines, and when those were coming out, most of those could not be finished when run around the country because there wasn't a diverse population. And they were brought here to Houston to be finished up to really give that diversity profile that's necessary when you're ever creating a vaccine for the entire country. So we really kind of celebrate that a great deal. It doesn't touch on the AI side, but it sets the platform. So when we do clinical trials here or do studies, including AI, that we've got the very best platform arguably in the country. We're a reflection of what many of these cities will become 10 or 20 years from now. So that's a real powerhouse for us to do a lot of these original studies, whether they be AI driven or not.
Jamie or Kengo, did you want to weigh in?
Yeah, no, I think for us, we're constantly evaluating different technologies, whether we develop certain things in-house versus other vendors that we may want to evaluate. So for us, we want to make sure that, from a data security perspective, right, from a processing and an outcomes perspective, right, we're all on the same page, which is why we established the council itself, just to make sure that there's not just one perspective as we evaluate these different alternatives. So for us, we want to make sure that there's a business case, business value, as well as there's ethical and controls in place before we establish or initiate some of these projects.
Absolutely. Kengo?
Yeah, so Houston has a very diverse population. So we try to contribute to this diverse population by providing our genetics testing through the consortium, which is called Texome Project, which is a combination of the name of Texas and the exome. Exome is a gene coding region of the protein coding region of the gene. So it's a pretty cool name, Texome. So this is a project, to provide the genetics testing access to diverse population, including underserved population, who has potential rare disease. So we work with Baylor College of Medicine and the Texas Children's Hospital. Then we provide not only genetics testing but also genetic counseling and genetic expertise to underserved population, so that even they can they can access to the latest technology of genetics. So we provide the whole exome sequencing, kind of cutting edge genetics testing technology through this consortium. So yeah.
Switching gears a little bit, telemedicine has gained significant traction in recent years. How is Houston integrating telehealth into its existing healthcare and insurance infrastructure? And what have been the primary challenges and benefits observed by your company in this transition? Bill, do you want to start?
Sure. COVID, another instigator for telemedicine. I mean, telemedicine was fairly much on the periphery, and largely, if you look at technology that's brought into any healthcare platform, it is about economics, because we always knew that telemedicine could play a really large role. I actually did a study back at Stanford in 1992, dating myself, and the only place that we could actually get it paid for was in prisons. Kind of a good place. You don't want to move people out of a prison, so you could do telemedicine, but there weren't the economics to pay for it. When COVID hit, government completely flipped the switch on that, and suddenly it became really viable. And through that experience, we saw a huge uptake in telemedicine being used. And now, for the most part, all of us, when you kind of want to see a physician or a specialist, often the case will be you can get it much sooner if you want to take a telemedicine visit, sit at the privacy of your own home and have an expert really come to you months earlier because of telemedicine. So I think it's here to stay.
Yeah, for sure. At UTMB, we have a lot of different areas that we serve. So we work a lot with NASA. We do a lot of work in Antarctica. We do a lot of work with the cruise industry, and also just want to generally serve the broad state of Texas, right? So for us, it was a little bit on the forefront, but to Bill's point, right, COVID accelerated that, right? So we wanted to make sure that we had capabilities to serve a broader population and make sure we were also still safe. So for us, it's definitely an opportunity that we're going to continue to explore and invest in. I think the challenge for us is really just making sure you have the right infrastructure. And then from a patient perspective, right, there's certain patient cohorts that are more familiar with technological, advances versus others. So making sure that there's training available, making sure that we have technology capabilities that can foster them learning and getting up to speed as to how it actually works. So those have been the challenges for us, just making sure that people are aware of the capabilities of the systems and tools and making sure that we're taking advantage of that.
I was just teaching my dad Apple Pay the other day, so I get it.
Perfect example.
Well done.
Kengo?
Yeah, so in genetics testing, genetic counseling is very, very important component, So genetic counseling can be provided through telemedicine platform. So usually genetics testing is a little bit complicated, for general, population. So they need to understand, what genetics testing means, by getting the pre and post counseling, So even after they get the result, they need to understand what this means through genetic counselors. So then telemedicine can contribute to, improving the access to genetics testing, even for the people who are not very familiar with genetics testing, So this is a very useful tool to democratize genetics testing. So we worked with the Baylor College of Medicine and then built a telemedicine platform, genetic counseling, which is called Consult the Gene, so that we can provide the genetic counseling service not only in the local area but also entire U.S.
And Rodgers, maybe you can weigh in on the telehealth benefits on mental health, and can you comment on Cigna's approach?
I think when we're talking about telehealth from a health plan perspective, this is table stakes. So we're going to have to be involved in telehealth really to provide access to our customers. Recently, I was talking to our telemedicine medical director, and he was actually telling me that 50% of our behavioral health utilization has been virtual. 50%. And this is a significant jump. And again, to your point, a lot of this evolved during the pandemic. But customers are requesting access and convenience. One thing we have been able to do, about a year and a half ago, we actually launched our own virtual therapy organization, which is called Evernorth Care Network for Behavioral Health. In addition, within the Cigna company, we have MD Live, which also provides telehealth treatment for behavioral health conditions. And again, our customers are not exclusive to these organizations. We realize it's going to take a village in order to provide access to our customers related to behavioral health. But customers are requesting access. They want care to be convenient. We're also looking at digital applications, texting applications, in addition to peer support. And just to kind of quickly definition that, peer support is support provided by a person. Again, this may not be a clinical or a licensed person, but a person who's had a condition or experience and providing support to that person who's going through a new onset conditions. So think of someone who's been sober from alcoholism for 20 years, providing support for someone who's struggling with their addiction and trying to reach sobriety. So this is definitely how we're evolving in behavioral health. From a challenge standpoint, credentialing. I was looking at my LinkedIn page and I realized since January of this year, I've had 15 outreaches from new telehealth companies requesting a meeting. Now, from a health plan perspective, one challenge we have is to understand quality and credentialing of these providers. So what we're doing now, we are actually partnering with potential vendors to understand how they're looking at quality and how that quality is being measured, how they are doing their own credentialing. And I think it's going to take that partnership to make sure with the telehealth providers, we're getting strong clinical outcomes.
I'd like to drill down a little bit and ask some individual questions, and starting with Jamie. As EVP and CFO of a health system, how are you managing the financial implications of integrating cutting-edge technologies? And what strategies have you found most effective in balancing investment and innovation with maintaining financial sustainability?
Well, there's no shortage of challenges, right? So the margins obviously are something that I'm constantly evaluating, looking at. But when we think about certain technologies, right? So we talked about a little bit about clinical documentation and physicians being able to utilize AI to document their notes and things like that. Those are things that I can sort of easily quantify in terms of physician efficiency, evaluating the business case, ROI, et cetera. There's other things that we're evaluating and exploring, though, that may not be as simple to calculate. And so things like, how do we provide AI technologies to allow patients to schedule more efficiently, allowing them to find the relevant physician based upon the issues that they have more readily available, as opposed to calling, you go through a decision tree and hopefully you get to the right physician, right? So how do we leverage some of those technologies? That's a little bit harder to quantify. But I think just because we're so focused on AI and how we can become more efficient, it's allowed us to be a little bit more nimble and allow us to evaluate these things on a more rapid basis. We know that technology is changing very rapidly. So I feel like almost every day something new comes about that we can explore and evaluate. So for us, it's trying to build the business case and from a financial perspective, build that ROI, but also understanding and recognizing that not everything can be specifically quantified, at least not today, and how we can evaluate things like patient satisfaction, quality, et cetera, that may not have a financial incentive, but may be beneficial for us and how we serve our patients.
And Rodgers, what challenges have you encountered in integrating digital health solutions for behavioral health into your insurance models? And how are you addressing issues related to reimbursement and coverage?
I think we've had a lot of success with reimbursement. Back in 2017, we made parity evident between virtual care and in-person care. So we've had a lot of success in this area. I think as we continue to evolve, how do we continue to think about access? And we've created fast access to our centers of excellence for adult mental health, for adult substance abuse, and in addition to child services. I think also as we start to think about continuing the growth toward value-based care, again, paying providers not only for the service they provide, but are they providing services that have quality included, in addition, whether they're performing around particular conditions. One barrier that I think we face in behavioral health, EHR, electronic health records, where we're talking about behavioral health providers, they may still use paper charts, and they are not on electronic health platform. And this is a barrier, especially as we continue to evolve value-based care. It becomes overwhelming for those mom and pop behavioral health providers to participate. And I'm sure you're seeing that, but how do we get to electronic platforms and move away from faxing information? And I think that's a challenge for us all.
Bill, what strategies are in place to bring technological advancements on a global scale to our medical campus?
Sure. So when I arrived here 10 or 11 years ago, if you look across the medical center, there were brilliant technologies that were being discovered at Baylor, UTMB, Houston Methodist, MD Anderson every day. But there was no platform in any of those. Baylor was probably one of the earliest ones to do some work, but there was really no investment. When you're running a hospital or you're running a research, that's kind of the business you're in. So to take spin out companies and really foster around it the technology that you need and the people around it. Scientists are great scientists. You want them to remember. I know one of the scientists at UT right now that probably has 11 candidates for brand new drugs in the market to transform cancer. 11. But this person is not trained to spin out and be a CEO and raise the first round of financing, whatever. So we started out building. So right now we've invested about $500 million. We built an innovation ecosystem. We have bio bridges right now with the United Kingdom, with Denmark, just got back from Denmark, with Ireland, Australia, and we'll soon open another in Asia in the next month. And so we bring those technologies from all around the world. And you'd be surprised to find that 60% of the companies that come out of our ecosystem to start up are from outside of the United States. And that's the great thing, is great ideas come from all around the world. And we have now become the port of entry for new technology. So we have a $50 million venture fund. We're often writing the first check we've got some great companies out of Baylor. We were the first check, even before Baylor, writing that first $2-3 million to help that company come out. So we have a number now coming out of MD Anderson and UT and others. So it's really about leaning forward. And right now, I think we put 400 companies through that created into the ecosystem. 3 of those are billion-dollar valuation companies. We have 4 life science companies that will probably be in that same area of valuation. So it takes a village to build it, but we have invested a huge amount of money into it, and we think it's kind of really a whole emerging area coming out of the Texas Medical Center in all of our institutions.
Amazing. Kengo, I wanted to ask you about personalized medicine. And before I ask a personal anecdote, about a year and a half ago, we found out that my daughter has an ultra rare genetic disorder. And so I've seen the world of genetics from a variety of sides. I've seen the telehealth side. We've seen a variety of genetic counselors and the ease and sometimes not so ease with working with that. Finally finding a diagnosis. I heard it not called a journey to a diagnosis, but an odyssey. And it very much feels like an odyssey. Now she's fine. Everything is good. She has treatment for her particular rare disease. But the importance of genetics and getting to that personal level is, I mean, that's what it is, right? And so as it's becoming a major trend, how is your company collaborating with healthcare providers to integrate genetic insights into personalized treatment plans? And what outcomes have you observed?
Sure. So this is one of the most exciting, area for us. So currently, genetics information, genetics technology is mainly utilized, to provide a diagnostic for like a sick patient. So however, genetics information currently cannot be utilized in the routine clinical settings. So because of a lot of technical barriers. But in the future, so if genetics information of all the populations are utilized in the routine clinical settings. So whenever you, or go to the doctor, so you can get, more like a personalized care, personalized service, based on your genetics information. By doing that, so for example, you can access to the right treatment, right drug, based on your genetics information. So in order to achieve this future, there are a lot of barriers. For example, so we need to understand the genetics information of general populations, including through, let's say, newborn screening or more like a population level genetics. Then those genetics information needs to be available for doctors with some specific insight. So in order to do that, so we have to overcome a lot of challenges such as, data privacy issue and new, infrastructure issues, So, but we are very, very passionate about creating this type of future where, genetics information is utilized to provide better healthcare for all the populations.
Can I brag on one thing?
Absolutely.
One thing that people might not realize, Baylor Genetics is a juggernaut in the industry. As a matter of fact, most of the US trials that involve genomics, the analysis is actually done at Baylor. You've heard of the Broad Institute in Boston. This is what we have here at Baylor. And there's also extremely strong genomics programs in other of the medical institutions. But what's really exciting for us all, and my wife was just sequenced the other day, because we're moving away from treating you as a class. I'm a breast cancer patient, so we're going to treat all of you that way. That doesn't happen anymore. For the most part, you're getting sequenced, and we're choosing drugs that are going to be specifically more effective for you than the next person. It's called personalized medicine, and we've been hearing about it for years. But it really is the knowledge now that we get from being sequenced. Most of you have been sequenced if you're on 23andMe. And that's great. You can find relatives in Ireland and you can go there and check them out. But this is really exciting for our future because the cost of doing a genomic sequencing and then really the analysis is the beauty from it is really dropped down now where it's becoming like a blood panel and it's used daily. So it's probably happening to you already. You see it in your My Charts, but it's a really exciting future in front of us.
Absolutely. Well, this discussion has been wonderful, and I'm sure I could lead this discussion for a far more time, but we need to conclude the panel. I know that Bill is running to the airport after this, so I'd like to toss out one last question to all of my panelists. Collaboration among stakeholders can drive improvements in cost management and transparency. How are Houston's healthcare systems, insurers, and technology companies working together to address rising costs and enhance price transparency as technology and innovation continue to shape the future of the industry? So we maybe go Rodgers back to Bill.
That's fine. I think the opportunity, and I think during the pandemic, we got a better understanding of how social determinants of health actually impact outcomes. I think using technology to understand the risk for social determinants of health among certain individuals would really benefit the individuals who are receiving care. But I think using technology, one thing we've been able to do at Cigna, we created a social determinant index. It is a way to assess a customer's risk for social determinants, be it issues of transportation, food, literacy, and a variety of other social determinant of health categories. I think using technology to better understanding that point would be beneficial. It allows local markets to look at playbooks, to close social determinants of health, but there is so much opportunity when we're thinking about social determinants of health and using technology to improve care. I'll stop there.
Kengo.
Yeah, so there's a concept which is called the population genomics, so which is very similar to population health. The idea is to provide the genetics testing to certain population, then try to understand the risk of this population, such as cancer risk. Then by doing that, we can understand what kind of disease risk is existing. Then in order to avoid a serious situation with a disease such as cancer, we can take the preventive action, so that we can overall, we can lower the cost, of this entire population. The other avenue is, to try to understand what kind of drug is effective and not effective, so we can avoid, prescribing the wrong drug to the patient. Then we can save money. So this is a concept of the population genetics, so then we can contribute to, value-based care. But, of course, we need to work with other, healthcare providers, health system, insurance companies to make this happen. But, Houston Texas Medical Center is a best location to work with, those partners.
Yeah, for us at University of Texas Medical Branch, we have I'll give a couple of examples. We have a couple of consortiums that we sort of all work together, both within the University of Texas system, but also other members of the Texas Medical Center. So for example, we all are on the Epic platform for, electronic medical record. And so we have a big consortium where we all get together and think about sort of what technologies, what advancements is Epic also thinking about from a industry perspective. So we have a collaborative sort of a partnership where we explore some of those things. We also work with Microsoft, and they have a program called Train that we work with people inside and outside of the medical center to evaluate certain technologies. So we're trying to leverage some of these companies that have the capabilities to invest in a lot of these areas. But we also know that they're going to be at the forefront in terms of AI and how we take advantage of those technologies. So for us, we're collaborating amongst and inside the medical center around University of Texas, but also focus on UTMB efforts as well.
And Bill?
So most of my job is to really kind of find avenues to connect these great institutions. But for over 80 years, think about it. Every one of these institutions was built individually. MD Anderson, Baylor College of Medicine, the list goes on. We're over 60 institutions. So it wasn't natural for them to actually do things together because they were so focused, and they often compete clinically as well as for research grants. That has completely shifted now. And it was really COVID imagine when COVID hit, I pulled all the CEOs together. None of our data was shared, none of it. So if you're trying to look at a 10 million person population, which is how many patients we treat each year at the medical center, we would have been looking at COVID from 15 different perspectives. And overnight, within 2 weeks, we shared all the data, came into my team, and we'd present it every 2 days. You probably got used to seeing those dials every day. People would call me. I'd get text messages from thousands of text messages like, where are the decks? Where are the decks? If they were 10 minutes late, people would freak. But it was probably one of the best exemplars of what we can do collectively together. Research, they share core labs now where they used to not do that. If you were training, if you're a Baylor and you wanted to take a research training class at MD Anderson, you couldn't take it. Now we train across the entire medical center. So it's really starting to take speed, but often what gets in the way is when you ask someone on procurement to buy together, which we did, we centralized our supply chain. As soon as COVID was over, everyone went back into their areas because you're asking people to say, hey, if you are all, procurement, supply chain people for Methodist and Baylor and UTMB, and let's do this together and make a central buy. Everyone gets very nervous. Like, wait a minute, no, I got this. We figured it out. And so those are some of the inertia that your human nature that take time to break through, but we're making huge progress. And I think that the future is very bright.
Well, I want to thank my panelists again. This was a amazing discussion with really some interesting information. Please give panel one another round of applause.